The other point I want to make, because after I've shown you how health care costs are going to go up under this legislation, is the other amazing thing about it, and this is, again, this is one of those phony accounting techniques or gimmicks that Washington uses, sort of same old business in Washington, same old Washington smoke and mirrors, ways of disguising what this thing really cost. In order to bring this thing in at about $1 trillion, which is what the Democrat majority wanted to do, they had to use a lot of budget gimmicks. And the senator from New Hampshire is here. He knows all about this because he's followed this very closely as the chairman of the Budget Committee for many years. But he can attest to the fact that one of the things that they did is they started the tax increases immediately. So on January 1st of this year, next year, which is now 18 short days away, all these businesses across the country are going to see their taxes go up in 18 days. But the amazing thing about it is many of the benefits don't start getting paid out for another 1,479 days. So they front load all the tax increases. So all these tax increases are going to get passed on immediately, and by 2013 every American family is going to be paying, starting next year, $600 a year up to the year 2013. So every American family is going to feel the brunt of these additional costs for taxes and the premium increases that will follow from those. But the amazing and remarkable thing about it is they actually structured a bill that would punish small businesses and people who are going to pay these taxes on January 1st of 2010, 18 days away, and don't start paying out the benefits under the bill for another 1,479 days. What does that do, Madam President? In the 10-year window that they use to measure what this thing's going to cost, it dramatically understates the cost of this legislation. And so what we're faced with is not a $1 trillion bill, but a $2.5 trillion bill when it's fully implemented, and when all these budgetary gimmicks and sort of phony accounting is actually taken into consideration. Madam President, this is a bad deal for small businesses. That's why all the small business organizations have come out opposed to it. And you cannot get up on the other side day after day and defy reality, and defy logic, and defy reason, and defy facts. And that's what those who are trying to push this huge government expansion and this huge takeover of health care in this country are trying to have people believe. They are just dead wrong. And I believe the American people are tuning into that, which is why increasingly in public opinion polls they are turning a thumbs down on this by majorities of over 60%.
I just want to answer a couple of things I see on the floor. I walked in, and my good colleague from South Dakota, Senator Thune, had a chart up. He had a chart up, and he said when your taxes will kick in and when your benefits will kick in. So I didn't hear the whole speech, and I feel bad about that, not having heard his whole speech. And I went up to him, I said, I didn't hear your whole speech, and he went, oh, man, that's too bad. And but I said, did you actually happen to mention any of the benefits that do kick in right away? And he said, no. Which I think is, you know, again, we are entitled to our own opinions. We're not entitled to our own facts. Benefits kick in right away. And if you're going to hold up a chart that says when taxes kick in and when benefits kick in, you say 1,800 days, you better include the benefits that do kick in right away.
The senator from Minnesota yield for a question?
Absolutely.
Would the senator from Minnesota, when I was pointing out on the chart, understand the point I was making, that the tax increases start 18 days from now, and that the benefits, the spending benefits under the bill, which are the premium tax credits and the exchanges that are designed to provide the benefit that's delivered under this bill, don't start until 2014.
Does the senator understand that spending benefits start right away?
If the senator missed the point, I can get the chart out again.
I asked you a question, Senator. I yielded to you for a question. I'm asking you a question. Does the senator...
The senator from Minnesota may only yield for a question. And the senator from Minnesota has the floor.
Has to what?
Has the floor.
I have the floor? Okay. The senator from South Dakota said, did I realize that I was talking about the spending doesn't start for 1,800 days on health care. The benefits don't start. Here's one. $5 billion in immediate federal support starts immediately for a new program to provide affordable coverage to uninsured Americans with pre-existing conditions. I don't know about anyone else in this body.
Would the senator yield for an additional
That's
question?
exactly right. And what Senator Franken's saying, the $5 billion here is for the high-risk pool, people who have the most trouble because of pre-existing condition, because of insurance companies, the behavior of the insurance companies. And this debate's really all about the insurance companies. My friends on the other side of the aisle always come down on the insurance companies. The insurance companies really are the ones that are driving so much waste and so much bad behavior in this system. And the other thing another thing in this bill that's very, very important now is the Medicare buy-in. That the Medicare buy-in that we've been discussing, that somebody that's 58 years old or 62 years old and can't get insurance, they've been laid off, or maybe they have a pre-existing condition, or maybe they're part of a small business that doesn't insure them, 58, 62 years old, that simply can't get insurance. This legislation will allow them so far to buy into Medicare. I know my Republican friends can't make their minds up what they think about Medicare. They've opposed it mostly for 40 years. They opposed its creation. They tried to privatize in the mid-90s. They succeeded in partially privatizing it. They tried to cut it. Now when we've simply, at the AARP's request in part, pushing legislation that will cut some of the waste out of Medicare, all of a sudden they're big fans of Medicare. But then they don't like Medicare again because we're going to do the Medicare buy-in. So I guess I'm just confused by it.
Would the senator from Ohio yield for a question?
I would just
Would the senator from Ohio yield for a question?
We gave the other side 30 minutes.
We have our time.
I know that Senator Thune wants to sort of monopolize our 30 minutes.
I don't think we've seen that provision.
We have our time, and the senator from South Dakota just said that when he gave his presentation, he was saying that nothing that we're paying for starts until 1,800 days from now. I have a whole list of things that start. The Patient Protection and Affordable Care Act.
The senator from Minnesota has the floor. He may engage in a colloquy. He does not have to yield to any further questions.
The Patient Protection and Affordable Care Act will prohibit insurers from imposing lifetime limits on benefits. Starting day one. Starting day one, Senator. He doesn't want to hear it. He doesn't want to hear it. We are entitled to our own opinions. We're not entitled to our own facts. The fact is, benefits kick in on day one, and the large majority of benefits kick in on day one. And we shouldn't be standing up here with charts that say the exact opposite. Senator McCain, a week ago, said facts are stubborn things. These are stubborn things. Small business tax credits will kick in immediately. The senator from South Dakota just said that no payments, nothing that costs any money will kick in right away. That's not true. We are not entitled to our own facts. And I stand here day after day after day and hear my colleagues, my good friends from the other side say things that are not based on fact. We hear this $78 trillion unfunded liability. You know, I remember during the Social Security thing, we used to hear this 11 trillion unfunded mandate in Social Security. Then they asked the actuary what that was about, and at the Treasury Secretary Snow. And what it was because the American Actuarial Society got really mad about this, because you know what it was? It was into the infinite horizon was the liability. It was into infinity. And that was a figure used by the President of the United States, George Bush at the time. We have an $11 trillion unfunded mandate. What was the actuarial thinking behind it? Into infinity, and people would live to 150 years old. Well, the senator from Minnesota, one second. I want to explain the end of this. So this was the unfunded liability, assuming people lived to 150 and still retired at 67. That was an 83-year retirement. And that we'd live to 150. I assume the first 50 years would be great, the next 50 years not so great, the last 50 years horrible. Ridiculous stuff. Let's have an honest debate, for goodness sakes. Let's not put up charts that contend one thing and that are just not true. We're actually addressing that donut hole that was in the Medicare Part D bill. We're closing it by half. And you know when it starts? Next year.
I thought Senator Thune said none of the benefits started.
Senator Thune did say that none of the benefits started next year, but he just, I guess, hasn't read the bill. I have so many constituents come to me and say, read the bill, read the bill, read the bill. And I would ask,
gentlemen, yield, perhaps if you're going to vote against it, you don't need to read it. Is that the way they think about it?
I do find that many of my colleagues who I'm very friendly with have not read the bill and are not very familiar with it. And I think that if you're going to get on your feet and debate and make assertions, you should really be familiar with the content of the bill. That's what I thought. I've only been here a while, so maybe I'm naive. But I think when you say that none of the benefits are going to start next year, you should be right. And when I hear presentations from my colleagues, I want them to remember what Senator McCain said when he said facts are stubborn things. When we debate in this hall, on this floor, let's stick to the facts. So many of the benefits in this bill start immediately. And it simply is not fact to say they don't.
By the way, could I just mention, I don't quite seen anything on the floor of the Senate, as I saw the senator from South Dakota challenged earlier today. I was watching proceedings on the floor. I wonder if the senator from South Dakota would like to maybe respond to really accusations of misleading information, I guess is the kindest way I could describe it.
Well, I appreciate the senator from Arizona yielding. I appreciate the discussion of all our colleagues on the floor here this evening who are pointing out not only how flawed this process is and that it's being conducted behind closed doors in contradiction of all the promises and the commitments were made, that this is going to be a transparent, open process. The senator from Arizona has been great at, I think, holding the other side accountable when it comes to these all these pronouncements about how this is going to be an open and transparent process. Clearly that's not the case. There's something going on right now that we're not privy to, and I think at some point they're going to throw something, as the senator from Arizona said, at the wall, hoping that this latest thing will stick. But I do want to make one observation with regard to the discussion that's been held earlier today, because someone, a member of the other side, senator from Minnesota, had indicated that he thought that this chart was somehow inaccurate or misleading. And I want to point out again, Madam President, that the chart is very accurate. In fact, the taxes in the bill begin 18 days from now on January 1st of next year. January 1 of 2010 is when the taxes under this bill begin. And in fact, almost $72 billion of taxes will have been collected before the benefits that start to kick in will be paid out. The premium subsidies that are going to support the exchanges that are supposedly going to help those who don't have insurance get access to it. That's 1,479 days from now. Now, what the senator from Minnesota got up and said is, he said, and I quote, "We are entitled to our own opinions. We're not entitled to our own facts. The facts is benefits kick in on day one, and the large majority of benefits kick in on day one. Kick in on day one, and we shouldn't be standing up here with charts that say the exact opposite." Well, Madam President, it's not me saying this. It's the Congressional Budget Office. The Congressional Budget Office has said that 99% of the coverage spending in this bill doesn't kick in until January 1 of 2014, or 1,479 days from here. Now, I say to my colleagues and to most Americans around this country, do you think it's fair to construct a bill that, in order to understate its total cost, starts raising taxes in 18 days, but doesn't start delivering 99% of the coverage benefits until 1,479 days from here? Now, if the other side wants to have an argument about whether 99% of the coverage benefits kick in the year 2014 or 100%, I'm happy to have that argument. The point is simply this. Taxes start 18 days from now. Tax increases. $72 billion in taxes will have been imposed upon the American people, and the benefits 1,479 days from now. So, Madam President, I want to make that point and refute the argument that was made by the senator from Minnesota that a large majority of benefits kick in on day one. 99% of the benefits don't kick in until later. Now, incidentally, I have an amendment that I hope we get a chance to vote on that will delay the tax increases until such time as the benefits begin. We think it's only fair to the American people that we synchronize the tax increases with the benefits. Now, many of us don't support the tax increases in the first places, which was why we'll be supporting the Crapo amendment tomorrow to recommit the tax increases back to the committee and hopefully get rid of them. But if you're going to have tax increases and you're going to start raising revenue immediately, then you ought to start paying out the benefits at the same time, or at least delay the tax increases so that the benefits and the tax increases are synchronized. That, to me, seems like a fair way to conduct and to do public policy for the American people. This clearly isn't the case. And the reason it was done this way, Madam President, let's be honest about it, and the newspapers have made it pretty clear that in some of the statements that they've made, the Washington Post, the measure's effective date was also pushed back by 1 year to 2014. That projection represents the biggest cost savings of any legislation to come before the House or Senate this year. But the measure's effective date was also pushed back. They keep pushing the date back to understate the cost. The reason they want to start collecting revenue right away and not start spending until later is because they know that if they start the spending earlier on, they're going to start inflating significantly the cost of this thing, and the goal was to try and keep it under $1 trillion. We all know now, and they've acknowledged, that the 10-year fully implemented cost of this isn't $1 trillion, it's $2.5 trillion. The American people deserve to know the facts. That's the fully implemented cost, and the only reason that they can say that in the first 10 years it comes in at $1 trillion or thereabouts is because the tax increases start January 1 of 2010, and the benefits, 99% of the benefits, don't start kicking in until January 1 of 2014. So I thank the senator from Arizona for giving me the opportunity to clarify that. It is important that we make this debate about the facts. I've tried to do that when I come down here and speak, and I'm happy to have the opportunity to restate the facts as they exist, as they have been presented to us by the experts, by the Congressional Budget Office, and by the CMS actuary, both of whom have concluded the same thing when it comes to the benefits and what the impact this is going to have on premiums in this country, which I think is probably the most devastating blow to the argument the other side has made in support of this bill, when the CMS actuary came out last week and said this is actually going to increase, this is going to increase the cost of health care in this country by $234 billion over the next 10 years. So, Madam President, I'm happy to yield. I see a number of our colleagues are on the floor. The leader is here as well, and I would certainly yield some time to the leader.